menjali mencari cinta, cinta bersemi saat pandemi. Oh, masker dan vaksin mengikat janji, janji setia, setia abadi. Oh, masker, oh vaksin, kau duet sejati. Ayo masker, ayo vaksin, tiada yang dapat merenggut sehatmu. Oh masker, oh vaksin, kau duet sejati. Ayo masker, ayo vaksin, tiada yang dapat merenggut sehatmu.
Well, thank you very much for that video, and I'd like to welcome you again, Professor Wiku.
Thank you.
My name is Ed Davies. I'm the Joint President of the JFCC. I'd like to welcome you all here today for a briefing again with the Professor, who is the spokesman for Indonesia's coronavirus task force, and is going to give us an update on the latest situation in the country. While the caseload has thankfully been coming down a lot recently, allowing the country to open up more, we all know by now how unpredictable this virus can be. So with that, I'd like to pass over to Professor...
Recording in progress.
Okay, are you giving a presentation,
Yes.
Professor? Or...
Yes. Okay, thank you, Ed David. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon to all members of the press, and also thank you for coming to today's press conference sessions. To start the sessions today, please allow me to deliver updates on COVID-19 management in Indonesia before moving forward to the question and answers sessions. And the current conditions of COVID-19 in Indonesia has improved after previously being affected by the third spike amid the circulations of the Omicron variant. And this improvement occurred comprehensively, both in terms of positive cases, active cases, death, and also recovery, and also bed occupancy rate to the positivity rate. However, amid the improvements observed at the national level, there are still some areas that have contributed to the increase in cases in various aspects. And for that, the key is not to give space for transmissions to occur at all. So there is no one gets infected again. And of course, during this policy adjustment period, the responsibility for preventing transmissions depend on each individual's awareness of the following four things. The first is discipline in implementing 3M health protocols, and two, get tested if you feel symptomatic or after doing high-risk activities such as long-distance travel and activities in crowded locations. And the third, isolate yourself if identified as positive. And lastly, the fourth, actively participate in vaccinations program, particularly the booster program. To ensure the effectiveness of this transmission prevention, the effort must be carried out not only by the Indonesian public, but rather all travelers who intend to stay, conduct activities, as well as participating in the community. And next, I will convey the details of the development of the COVID-19 cases in Indonesia. When viewed from the trend of national cases, the improvements that can be observed are as follows. The first is the nationwide weekly positive case trend has been down for 7 consecutive weeks past the peak of the third wave. And the government aims to continuously suppress the number, especially in the provinces with the largest contributors to the addition of positive cases over the last 7 days, and namely DKI Jakarta, which is 3,895 cases. In West Java is 2,318 cases. Banten is 1,256 cases. And Central Java is 1,227 cases. And East Java is 873 cases. Second, the national active cases have also shown a significant decline over the last 6 weeks. And the national active cases percentage, which is around 1%, is far beneath average world number, which is currently about 8%. Nonetheless, in the midst of this decline in national active cases, there are still 2 provinces that experienced an increase in weekly active cases, namely Papua, up 15 cases. Papua up 84 cases, and West Papua up 15 cases. And active cases must be kept low by avoiding the addition of the positive people to a minimum and seeking cures for infected people. And third, a downward trend was also observed in the death rate, which had fallen for 5 consecutive weeks. Unfortunately, the death percentage in Indonesia is still higher than average world rate, despite the positive cases number is already below world average. And in addition, there are still 5 provinces with the largest contributor to death cases over the last 7 days, including East Java, which is 81 cases, Central Java 47 cases, West Java 35 cases, DKI Jakarta 30 cases, and special region of Yogyakarta is 27 cases. Fourth, the trend of recovery has increased again after previously declining. At present, the percentage of recovery rate in Indonesia is about 7% higher than it is in world average. And as of April 10th of 2022, the 5 provinces with the highest percentage of recovery coming from West Papua, which is 98.5%, DKI Jakarta 98.4%, Banten 98.3%, and Maluku 98.2%, and also South Sulawesi 98.1%. And fifth, the bed occupancy rate, or BOR. The national BOR has dropped significantly from the previous 40% during the peak of the third spike, currently only at around 4%. However, there are still provinces with BOR above the national figure, with the 5 provinces with the highest BOR as follows. The East Nusa Tenggara is 8.8%, and special region of Yogyakarta is 8.29%, and Central Sulawesi is 7.87%, and Central Kalimantan is 7.71%, and North Kalimantan is 7.47%. 6, the positivity rate, or the number of people who were detected positive from the total number of people tested, has also shown a significant downward trend. Unfortunately, this decrease in the positivity rate is also accompanied by a decrease in testing. In January last year, the low positivity rate occurred in high testing coverage, reaching more than 200,000 people tested per day. Meanwhile, currently the number of people being tested is just under 100,000 people. Reflecting on the 6 case indicators, improvement in all aspects ranging from positive cases, active cases, death, recovery, BOR, to testing and positivity rate can be done by preventing transmission from occurring at all. I'm emphasized again, this can be done with high awareness from every community to be disciplined in carrying out the 3M health protocols, awareness to be tested, and awareness of self-isolations if positive. And local governments in provinces that still need improvement in case indicators also need to continue to monitor and improve community discipline in their regions, while continuing to seek control measures in the form of active posts and micro PPKM, as well as ensuring the availability of adequate health facilities. Lastly, in regards to the development of vaccinations in Indonesia, current data shows that the coverage of the first dose of vaccinations has now reached 94.88% of the target set by the Ministry of Health, while the second dose has reached 77.62%, and the booster dose has reached 13.27%. And this vaccination achievement was contributed by all provinces in Indonesia, of which 12 out of 34 provinces successfully surpassed the target for complete dose of vaccinations. For this reason, the government continues to strive to improve the achievement of complete and booster doses of vaccinations, which also needs to be supported by the role of local governments so that the protections to ensure equal vaccination rate all across Indonesia. This year, our Muslim brothers and sisters are entering the third month of Ramadan during the COVID-19 pandemic. The government, through the Ministry of Religion, has released a circular number 8 of 2022 regarding guidelines for the implementations of worship in the months of Ramadan and Eid 1443 Hijriah 2022. With conditions getting under control, the government decided that worship, especially Taraweh prayers, can be carried out together in congregation, and details of the regulations are as follows. The community can perform the worship of Ramadan and Idul Fitri in accordance with the provisions of Islamic law, and the community is again invited to fill and improve practices including Taraweh prayers, itikaf, tadarus of the Quran, recitations, zakat, infak, alms, and endowment, while still abiding to all health protocol measures. The persons in charge of mosque or musola must ensure the implementations of health protocols during Ramadan and Idul Fitri worship according to the circular and the status of their respective regional levels. Those who are in charge of mosque or musola must appoint officers who will ensure the socializations and implementations of health protocols to all congregations. The implementations of other routines during the months of Ramadan, such as sahur on the road, ngabuburit, buka bersama or collective breakfasting, or open house, must still consider other factors such as urgency and the risk of transmission. And the public is asked to constantly monitor the development of the latest regulations applicable in their area of domicile or their traveling destinations. Additionally, please also pay close attention to policies issues by place of work. And it should be remembered, vulnerable populations such as people who have not been fully vaccinated, the elderly, and people with comorbidities need to be more careful in carrying out large social interactions, considering that their conditions may induce higher possibilities of severe symptoms that may result in death. Up next is the updated information regarding traveling arrangement in Indonesia during the month of Ramadan and Idul Fitri. Statistically, it is predicted that the rate of the mobility of the Indonesian population will increase given that homecoming or mudik will be permitted, and visa exemptions for ASEAN residents and applicable visa on arrival. And also, to ensure a safe journey, please take note of this information prior to deciding to travel around Indonesia or before entering the country. And specific to domestic travelers and for all modes of transportation, first, it is not mandatory to show COVID-19 test results if the individuals has been boosted in terms of vaccine. However, if you have yet to receive a booster shot, negative test result will be mandatory. Second, people who have been vaccinated twice must present negative antigen test results taken 1 times 24 hours or PCR taken 3 times 24 hours before departure. And third, those who have just been vaccinated once must show negative PCR test result of 3 times 24 hours before departure. And those who cannot be vaccinated due to specific health conditions or comorbidities must present negative PCR test results taken 3 times 24 hours before departure and official letter from hospital addressing inability to receive vaccination. In addition to facilitate community mobility, children aged 6 to 17 years are required to carry out testing, considering that currently they may not be able to access vaccine booster. On the other hand, children aged below 6 years who cannot be vaccinated are not required to carry out testing, provided that they are accompanied by a travel companion who has met the domestic travel requirements. And it should be noted that the government will continue to improve the accessibility of child vaccinations. Nevertheless, considering the limited number of reports regarding vaccinations trial for children under 6 years, as well as booster vaccinations for children in general, the government will focus on achieving vaccination targets for vulnerable groups such as the elderly. Meanwhile, specifically for incoming trips to Indonesia, the government stipulates provisions for foreign travelers as follows. First, it is compulsory for all foreign travelers to download the Peduli Lindungi application and to fill in the required personal details information. However, travelers with specific health conditions or comorbidities who cannot be vaccinated must provide official letter from hospital in their origin country citing their inability to receive vaccinations as well as negative PCR test results. Meanwhile, foreign travelers who have been confirmed positive for COVID-19 in the last 30 days and are declared non-infectious or post-COVID recovery are excluded from showing their COVID-19 vaccinations card or certificate and negative RT-PCR results before departure. Instead, foreign travelers in this category are required to carry out an RT-PCR examination upon arrival and show a doctor certificate or COVID-19 recovery certificate from the government hospital of the country of departure or the Ministry of Health in the country of departure, stating that the person concerned is no longer actively transmitting COVID-19. Second, the entry test is made mandatory for foreign travelers suspected for COVID-19 or for those who showing symptoms similar to COVID-19, for example, those with body temperature above the normal threshold of 37.5 degrees Celsius, and people classified as post-COVID recovery. Third, the obligations to undergo centralized quarantine for 5 times 24 hours is required for adult foreign travelers who have just received the first dose of vaccinations at least 14 days before departure or not at all, and foreign travelers below 18 years old who are accompanied. Fourth, the obligations for PCR retesting on the 4th day of arrival is mandatory for foreign travelers who are also required to quarantine as a condition for completing the quarantine period. Meanwhile, it is recommended that foreign travelers that are not vaccinated due to health reasons to also take the initiative to check themselves for mutual safety. On the other hand, given the uncertainty of conditions in this case, Indonesia, as what other countries do, for example, Thailand and Chile, to its tourism, and Denmark, and also Singapore for its daily activities, must continue its recovery efforts in other sectors such as education, economy, tourism, and others. And according to findings from the World Bank in 2021, shocks to the economic sector in various countries were contributed by policies to limit community activities and people's behavior. Both are able to have an impact on reducing the intensity of economic behavior, either because of restrictions on space for movement or because of a decrease in productivity due to the emergence of new cases and deaths. Although the latest government policy adjustments showed some relaxations in the mobility aspect, the government continues to balance this by ensuring strict protocols are still in place, such as the mandatory use of masks. And I will close these sessions with additional updates of COVID-19 management in Indonesia in reference to the Task Force Circular number 17 of 2022, effective as of April 5th, 2022. There are additional entry points for international travelers that were set to facilitate community activities that are safe from COVID-19. The additional entrances include airports, Soekarno-Hatta, Banten, Juanda, East Java, Ngurah Rai, Bali, Hang Nadim and Raja Haji Fisabilillah, Kepulauan Riau, Samratulangi, North Sulawesi, Zainuddin Abdul Majid, West Nusa Tenggara, Kuala Namu, North Sumatra, Sultan Hasanuddin, South Sulawesi, and Yogyakarta, Special Regions of Yogyakarta. And the seaport is Tanjung Benoa in Bali, Batam in Kepulauan Riau, Tanjung Pinang, Bintan, and Tanjung Balai Karimun in Kepulauan Riau, and also Nunukan in North Kalimantan and Dumai in Riau. Post for the country regions is Aruk, Kalimantan, West Kalimantan, and Tikong in West Kalimantan, and Mota Ain in East Nusa Tenggara. And the Ministry of Law and Human Rights, through the circular number 0549 of 2022, also released a list of special immigration checkpoints to support sustainable tourism. And later, tourists from the Brunei Darussalam, the Philippines, Cambodia, Laos, Malaysia, Myanmar, Singapore, Thailand, and Vietnam can enter Indonesia without a visa or visa-free subjects for special tourist visits. Meanwhile, tourists from 43 other countries that have been mentioned in the circular are given the convenience to enter Indonesia, where they can apply for a visit visa on arrival. And regarding the emergence of the new COVID-19 variant, namely Omicron XE, the Indonesian government, through the Ministry of Health, has confirmed that this variant has not been found in Indonesia. Nevertheless, the government will continue to monitor and utilize all the latest available data while still prioritizing the precautionary principle in various policy adjustments, especially related to the international arrival policy. And this will conclude the COVID management update for today, and I will continue to answer questions given by the press. So, thank you very much.
Professor, you did indeed cover a few topics that some of us were interested in, but I will first of all go through some pre-submitted questions. But if anyone would like to ask questions, please either put in the group or raise your hand, since we have a reasonable size group today. So yeah, one question I had was about the new variants such as Omicron BA.2, and how concerned you are about this type of variant, and given that there's been a sharp rebound in coronavirus cases in many other countries, including Britain and in fact a string of countries. So just a question on that.
Okay, thank you. So based on the GIS8 data as of April 11, 2022, over the last 4 weeks, more than 135,000 Omicron sequences have been reported. And this dominates 99.5% of the Indonesian sequence sample. And Omicron BA.2 is one of the detected subvariants, but the sequence proportion is still quite low. And in the midst of the predicting its potential to cause a spike in cases, The Indonesian government continues to strengthen preventive measures by intensifying discipline of health protocols with community-based surveillance, modifying mobility policy according to COVID-19 numbers, and increasing vaccinations coverage and rates. So thank you.
Okay, and then another question, which I suppose could be partially related to this perhaps, and you did partially answer it, but what do you expect to be the impact of the spread of coronavirus cases, of allowing tens of millions of people to travel for Mudik and Eid al-Fitr celebrations this year? I mean, obviously, it is a huge number of people who will be on the move, and we haven't really had that, at the same extent for the last few years. So how do you see the impact of this?
Yes, the Mudik policy this year is a result of a long process of monitoring and consideration, and this includes COVID-19 case number, each region's vaccinations coverage, including booster in priority to vulnerable populations, such as elderly, and also policy implementations, as well as the readiness of the public facilities for mass mobilizations, and its screening in origin and destinations area of travelers. And at present, to achieve good implementations of policy, the government supports the event of free and mass homecoming in many regions in Indonesia. And for these reasons, the government is optimistic that we can hold a COVID-19 safe Mudik this year. And this will be possible if the tailored Mudik policies are well executed in the field, as well as the compliance of the people. Government also stays to monitor the case development to anticipate potential case spikes after the Eid al-Fitr, and we always conduct the coordinations meeting across ministries, institutions, and also with the local governments. Thank you.
Okay, so I suppose we'll have to wait till after Lebaran to see, but hopefully, as you say, if these can be followed. Just a question on the G20, which obviously in Indonesia has the presidency this year and has been leading some talks on health issues. I just wondered if you could update us on any of the agreements up to now and any of the events going on.
Yes, together with all members of the G20, Indonesia has drawn up an exit strategy from the current pandemic to solve health issues. And there are at least 3 derivatives agendas that are
maybe having some technical issues.
Okay. Probably we can manage the transmission problems.
Yeah.
Ed, can you hear me now?
I can hear you now, yeah. You just froze for a while for me anyway.
Okay.
I'm not sure if it was for everybody.
Okay, let me repeat. So together with all members of the G20, Indonesia has drawn up an exit strategy from the current pandemic to solve health issues. And there are at least 3 derivatives agenda that are discussed in the issue of global health architecture, namely aligning a global health protocol standard, and then building the resilience of global health systems, and developing study centers, as well as manufacturing to prevent, prepare for, and respond to impending health crisis. Specifically related to health protocol standards of G20 events, amidst increased mobility trends, the Health Working Group has agreed on a method of digitizing health protocol documents and digital monitoring. This includes vaccine certificates with QR codes according to WHO standards. And the policy will be implemented in all G20 member countries and can gradually be applied to other countries as well. Thank you.
Okay, thank you. A question from Patrick Fitzgibbon at the New Zealand Embassy. On current regulations for entering Indonesia, travellers arriving with a medical certificate stating they have recovered from COVID-19 still required to undergo a negative PCR test on arrival, because some people, he's pointing out, can continue to test positive for months after recovering from COVID-19.
Yes, thank you. So based on the National Task Force for COVID-19 Circular Letter number 17, year of 2022, foreign travelers who have been confirmed positive for COVID-19 in the last 30 days and are declared non-infectious post-COVID recovery are excluded from showing their COVID-19 vaccination card or certificate and negative RT-PCR results before departure. Instead, foreign travelers in this category
Recording in progress.
are required to carry out an RT-PCR examination upon arrival and show a doctor certificate or COVID-19 recovery certificate from the government hospital of the country of departure on the Ministry of Health in the country of departure, stating that the person concerned is no longer actively transmitting COVID-19. So, thank you.
Okay. A question in the chat from Ahmed Fauzan Jantara. Are you concerned about COVID cases in China, specifically Shanghai, which obviously has had a zero case approach, but cases there are continuing to rise? Obviously, perhaps not Indonesia, but looking at overseas, Professor.
Yes, of course, the global development of COVID-19 is always our observed to see what is going on in the world. And one of the interesting event is the case in Shanghai, China. And we've followed up with the informations regarding the variants circulating there and the number of the cases. And of course, we are maintaining to see our policies in Indonesia, especially with the foreign people who are coming to Indonesia. We want to make sure that it's always under control. So that's why we are relaxing our policy, but in the same time, we are looking at the development in other countries as well, especially in the neighboring countries. Thank you. Any other questions?
Yep, there's a question from Natalia at AFR. Question about the development of the red and white Merah Putih vaccine, and also when will the Indonesian government provide booster vaccines for children?
Yes, at this moment, the government is focusing on the vaccinations of the booster vaccines, and especially for the elderly. But in the same time, we are making sure that the stocks are available for the children above 6 up to the 17th. But we also want to get the results of the clinical trials and informations regarding this. Thank you.
Okay. I don't think we have any immediate questions. I mean, I just had a little follow-up on tourism. You know, I mean, sometimes I'm still seeing some confusion. I mean, in terms of, obviously, ASEAN tourists can now come without any visa, correct? And,
yes.
But for other foreigners who were previously subject to visa on arrival, they can now get that?
Yes, yes. So basically, we are opening the number of the countries with the visa on arrival, which is this is part of the relaxations of restrictions that we had before, and we hope that the tourism in Indonesia will be improved.
Okay, and are there still restrictions on people having to book hotels, or there seemed to be some confusion from some people overseas, I know, asking about whether they still needed to book a hotel. I think previously it was required when you were going through Bali, for instance?
Yeah, no, there is no requirements to show the book of the hotels right now because there is no quarantine policy except for those who have incomplete vaccinations.
Okay, thank you.
Okay.
Doesn't look like we have an immediate question.
Okay.
When will the Indonesian government grant journalists visiting visas for issues other than G20? What is the consideration of the Indonesian government for not giving the visa? And I can update you slightly on this in that it does appear that that foreign media with representative offices can now start reapplying for visas, Natalia. But I'll hand over to Professor Wiku if he knows anything about. I think it's been much harder for journalists to get visas, obviously partly linked to the pandemic situation, but we have been checking with various ministers about when it's going to open up as it was before, I suppose, beyond just special ones for G20.
Yes, I think the journalists can come to Indonesia and also they can apply for the visa on arrival. And hopefully that those journalists are coming from the list of the countries that part of the visa on arrival.
Okay, but then they need to be careful reporting, otherwise they can get in trouble.
Yeah.
But I think I suppose we're looking at longer term visas, but that's maybe a little bit. But Natalia, I can definitely try and update you on that because we have been in contact. JFCC has been in contact with quite a few ministries, and it's still not as open as it was or previously, unfortunately. But it is for media with I'm told that for media with a representative office, they can start applying again. But you may need to sort of make sure this is reinforced at the embassy end because sometimes it doesn't seem like this news has gone to all embassies yet. So.
Yes, we will inform the Ministry of Foreign Affairs and also Ministry of Law and making sure that the visa for the journalists can be informed to public in terms of when they want to come to Indonesia. Thank you. Thank
you. Okay, well, we don't have any more questions right now, but I'd like to thank you, Professor, for giving us another update. I mean, it's obviously all looking, the trend is looking so much better, which is very positive, and we hope it obviously stays that way. But we will be keeping in touch with you, and perhaps we will need an update after Lebaran, see how things are looking. But thank you again, and I apologize for a few tech issues we had today with some freezing, but I hope everybody who wanted to ask a question or managed to get the answer to it. So thank you again, Professor.
Okay, thank you very much. Good afternoon. Thank you.
Thank you.
Pandemi hanya akan pergi bila kita saling peduli. Sebab bila tidak, gelombang baru datang dan pergi. Berani mengingatkan orang lain untuk lindungi diri, saling jaga, mau menerima dan rela memberi. Kencangkan lagi maskermu. Kurangi mobilitas dan hanya untuk yang perlu. Rutin olahraga dan vaksinasi lengkap demi imunitasmu. Kita percaya, kita pasti bisa.